I'm Dr. Don Bottom with Personalized Wellness. Today, as you can tell, we're in casual attire. It's a Sunday here at the clinic and it's 95 degrees in Mississippi. So I decided just to wear a t-shirt down here to shoot this video. So again, if you like the site, please hit the subscribe button. It's a really small little button. It's a little red subscribe at the very bottom of the screen. Click on that and that helps us out as basically as a site on YouTube, and it becomes important as far as getting this message out and getting it disseminated. All right, so today what we're going to talk about, we're going to go back to IV nutritional therapy, and I'll have the last video that I did on IV nutritional therapy. You'll be able to click on it up in one of the corners, and you'll be able to check that video out. But today, really what I wanted to talk about to begin with is I see a lot of IVs and IV therapies advertised, and a lot of times they're in, they're not by physicians. These are people, I don't even know if they're healthcare providers or not that are doing these. So I think that the one take-home point that I can tell you is most of what's being done out there in these kinds of clinics, if it's not done by a professional who's been to courses and knows what they're doing as far as mixing these things up, they're pretty worthless, to be honest with you. They don't really provide very much. So for the most part, I kind of think people are wasting their money on those particular therapies. I don't want to anger anybody about that, but it's just kind of my belief. So the first thing I want to talk about, overall, the most important thing about all of this is safety. So it always comes down to a matter of safety. And the first thing that the person or persons that are doing these IVs and making them up, they have to have an understanding of osmolarity. And if they do not have an understanding of osmolarity, run for the door, because you can get very, very injured by these IVs, because the way we mix them up, they can be what are called hypotonic solutions or hypertonic solutions. And if you're given a hypotonic solution rapidly, it can be fatal. Same thing with very hypertonic solutions. If they're given very rapidly, they can cause a lot of injury. So you don't have to know the ins and the outs of osmolarity, but suffice it to say that our body's osmolarity is somewhere around 300. And anything around 300 is isotonic. Anything way below that is hypotonic. Anything way above that is hypertonic. I will say most of our therapeutic IVs are actually hypertonic solutions because we put so many things in them. And that's why we have to run them in so slow. The majority of our IVs that are therapeutic have to take about 2 hours to run in. And it's because there's so many things in them between magnesium and calcium, and high dose vitamin C. There's all of these things that are in there that make them a little more hypertonic. So we have to run them in slowly. So that's number one with safety. Sterility, I would say, is number two. They have to be putting the IVs in sterilely. They have to know what they're doing as far as maintaining a sterile, basically a sterile, field from the time they initiate the IV all the way down to starting it and connecting the IV. The other thing with sterility is they really should be mixing these solutions in these bags under a laminar flow hood. And, I just think that that's a good way to do it. I think that legally, if you mix more than 2 things in a bag of fluid, you're supposed to be using a hood. So that's something to check out. Make sure they're doing that. And then finally, you can have allergic reactions from these things, from almost anything you put in there, from the B vitamins to glutathione. These things have preservatives in them a lot of times. The vitamin C, all of these things have potentials for causing allergic reactions. So you want to make sure that these professionals, they know what an allergic reaction looks like, and then they need to be able to treat that reaction. The main things are you need to have epinephrine in your clinic, you need to have some Benadryl in your clinic IV, We keep Decadron in the clinic also. We have oxygen. We have laryngoscopes. Essentially, I could run a code here in the clinic pretty easily with everything that we have here in the clinic. So you want to make sure that all of those things are in place. Very unlikely to happen to have a really bad anaphylactic reaction, but these things are possible. I was just reading a case report today of somebody that was getting IV curcumin in California, and the patient died at somebody's clinic. So you need to make sure that they know what they're doing when they're giving these things. And then today, I don't want to make this too long, but I think the big pivotal point today is, why are we giving these things? I see these, Myers cocktails are very common, which have very little in them as far as being, extremely beneficial. That's why I don't really believe in them, and I don't even do Myers cocktails. And so what makes these IVs beneficial are essentially, the biggest thing is we are bypassing your GI tract. So by putting these things in intravenously, we're able to bypass your GI tract. We don't have to worry about absorption from any of the supplements or anything that we're giving you, because a lot of patients have major GI problems. They could have irritable bowel syndrome all the way to inflammatory bowel issues. They can have intestinal permeability. All of these things make it difficult to absorb very well what we're giving the patient. So with the IV route, you're getting good quality absorption because it's going straight into the vein. Then you want to know that we can give higher doses, with the IV route. And essentially, for example, vitamin C, if you take much more than a couple of grams of vitamin C, you're going to have some GI distress. Whereas we can give all the way up to 100, you can give all the way up to 100 grams of vitamin C. So, or 50,000 milligrams is very common. 100,000 milligrams are very common dosage. I wouldn't say very common, but we use up to 50,000 quite a lot. And so again, we can use much higher doses with these IVs, and we can cover a lot of different issues that patients may have with this IV therapy. Generally, what I do with the IV therapies, there's really, I would say, a demarcation of what I do. There's rehydrating protocols, and then there's therapeutic protocols. The rehydrating protocols basically are isotonic solutions that I mix up, but they're mixed up in sterile water, so I'm able to put in certain things that are going to make you feel better: B vitamins, magnesium, amino acids, and those things. So it's not just a bag of normal saline or a bag of lactated ringers that we're using to rehydrate you, but it's isotonic, so it is going to expand your volume, and they're rehydrating. The other, what I would call therapeutic IVs that we do, are much higher concentration. The osmolarity is going to be quite a bit higher, but they're going to have much higher doses of all these things. B vitamins, multi-B. Then we use a lot of B5. We use a lot of B6, magnesium, calcium, zinc, selenium. Very high dose vitamin C. I'm a big proponent of vitamin C, and so again, I think that's the key. Are you given a rehydrating formula, or are you given a therapeutic formula? And the therapeutic formula is, like I said, somebody needs to know what they're doing with these things, but they definitely work really well, really well. So again, hit that subscribe button down at the bottom, and again, it really helps us out as a presence on YouTube as we're trying to get these educational videos out there. The clinics in Ridgeland, Mississippi on Highway 51, 573 Highway 51. Give us a call, 601-898-0911. We'd be happy to see you here in the clinic, and we'll do things like IV therapy to make you feel better. So again, I'm Dr. Don Bonner, and everybody have a good day. Thank you.